Jerry Taylor, the co-chair of the ACHA COVID-19 Task Force and former Associate Dean and Director of the Health Center at Bentley University in Waltham, Mass. Today, we're discussing the ACHA COVID-19 Task Force updated guidelines for fall of 2022. I'm excited to have here with me today Dr. Jean Chin, the inaugural chair of our COVID-19 Task Force and Executive Director Emeritus at the University of Georgia's Health Center. She oversaw the entire writing team and also wrote the guidelines on treatment and prophylaxis. Jean, thanks so much for joining us today. Would you go over a few of the most important points from the guidelines on treatment and prophylaxis?
Pleasure, Jerry, and I'm happy to be here. There are 3 antiviral agents: nirmatrelvir, ritonavir or Paxlovid, molnupiravir or Lagevrio, and remdesivir or Veklury, and 1 monoclonal antibody, bebtelovimab, that are currently authorized to reduce the risk of severe disease, hospitalization, or death in the event of a SARS-CoV-2 infection. The prophylactic medication, this is a long name, tixagevimab and silgevimab. It's easier to say Evusheld. It's authorized for pre-exposure prophylaxis to prevent COVID-19, and it's dosed every 6 months if you need ongoing protection. These drugs have expanded our arsenal in managing COVID-19. However, and this is a huge however, they should never, ever be seen as a substitute for vaccination with one of the authorized COVID-19 vaccines. Those vaccines remain our primary weapon against COVID-19, along with those multi-layered public health prevention strategies, the masking, the physical distancing, the air quality, the hand hygiene, and the cough and sneeze etiquette. So remember, ounce of prevention worth a pound of cure, so not a substitute. The second thing to know about the treatment and prophylaxis, Jerry, is that the majority of our healthy, immunocompetent, traditional college-age students will not need, thank goodness, will not need these treatments. However, it is important for student health services staff to understand the dosing, how to utilize the drugs, the side effects, how to counsel students, how to initiate treatment or to refer students if they do need these drugs. And if possible, health services should always maintain a current list of local health resources where they could refer students that provide these treatments. Providers also need to remain vigilant to the variants that are circulating, which may render these treatments less effective. And then the final bullet that I had that I thought was the most important was that these antiviral agents and the monoclonal antibody should be initiated early in the course of disease or symptoms or diagnosis. The 2 oral agents, Paxlovid and Lagevrio, must be started or should be started within 5 days of symptom onset. The 2 injectables, this is how I remember that, the 2 injectables, Veklury and bebtelovimab, should be initiated within a week. So the orals within 5 days, the injectables within a week. And because of those time constraints, it is really important to have access to testing with rapid turnaround times so you can avoid any potential delays in treatment. So those are the 3 tips, Jerry.
Thanks so much, Jean, for sharing your expertise and your valuable perspective. This has been terrific. Many thanks also to our audience for watching this video. If you haven't accessed the updated fall guidelines, you can find these and other resources on the ACHA website. If you have specific questions, email us at contact@acha.org. And if you would like to join the discussion on this and other COVID-related issues, go to ACHA Connect. Thanks so much for joining us.